Hello doctors, I warmly welcome you guys in a brand new video of Mastering Forensic Medicine. In previous video, we have covered the introduction of toxicology. If you have not watched it, make sure to watch. The link for it will be in the description box. Before dwelling in the depth of toxicology, today first we have to understand some concept and manner of the treatment of patient of the poisoning. So for that, we are going to study the duties of doctor in case of poisoning. There are two types of duties for a doctor. First type of duties are legal duties, and second type of duty are medical duties. So basically, there are two types of duty that a doctor has to fulfill during a treatment. First is legal duties and second is medical duties. Medical duties are always are on higher priorities over legal duties. These two things in details in further video. First, we are going to discuss the medical duties of a doctor. What are the medical duties of a doctor? First is to stabilize the patient, stabilize the comatose patient. What a doctor is supposed to do in this condition? A doctor is supposed to do in these conditions is clear A, B, C, D. These four steps A, B, C, D. First is airways, B for breathing, C for circulation, and D for depression of CNS functions. These four things has to be monitored to stabilize a comatose patient. For airways, you have to clean it, intubate it, whatever that is. For breathing, you have to give some additional respiratory system, additional artificial ventilation system, whatever that is. And to depress the CNS function, we have to prevent the depression of the CNS functions. These should be kept in mind while stabilizing a comatose patient. Second is to remove the unabsorbed poison. Remove the unabsorbed poison. If the patient has ingested, inhaled, or even a contact poison, we have to remove the unabsorbed poison before it also starts showing its effect. So mainly there are three types of routes that are being followed: inhalation, second contact, and third is ingestion. For inhaled poison, the patient is allowed to breathe in free air or fresh air. In contact poison, the patient in contact with the wound, if it's in contact with the vaginal wall or rectal wall, the contacted area is washed for 30 minutes. And in ingestion, for ingestion, we use the term that is very popular, that is gastric lavage or emetic drugs. We induces emesis, that is vomiting. Third duty is to remove the absorbed poison which has been absorbed. We have to remove or decrease the digestion of that poison. For that, we use substance that is known as activated charcoal or even chelating agents. That is chelating agents. After that, the patient is administered with the antidote. And lastly are the symptomatic treatment. If the patient is having pain, we have to give painkiller. If the patient is having vomiting, we have to reduce the vomiting. We have to reduce the chances of getting aspiration. Whatever that is, whatever the symptoms are, we have to cure or we have to treat according to the symptoms. These are the main medical duties of a doctor in a case of any poisoning. Now we are going to discuss about the duties, that is our legal duties of a doctor. Legal duties are those duty that the doctor are bound legally to follow. The legal duties, what are the legal duties of a doctor? First of all, first of anything, in even in any patient, doctor is legally bound to write name, age, sex, and the identification marks of a patient. The doctor is bound to write the age, sex, name, identification marks of the patient. A doctor is bound to follow them. Then doctor should obtain a perfect or accurate history from the patient, either from the patient or the relatives or anyone who's accompanying the patient. Then the doctor should inform the police in a suspected poison case. If a doctor fails to inform the police, he is punishable under 211 BNS, or if he has given a false information, he is punishable under 212 BNS. Doctor is legally bound to arrange dying declaration for the patient if he is about to die. A doctor is legally bound to preserve all the evidences, lab reports, even blood samples, gastric sample, intestine sample, whatever sample he is taking, he is legally bound to preserve all those. These are some legal duties of the doctor in case of a poison. These are some duties that as a doctor or medical practitioner are bound to follow or are supposed to follow in a case of a poison. So we have learned today and we have successfully completed this topic, duties of the doctor. Thank you very much.